Okay, so welcome to Who Wants to Be a Millionaire Nclex edition. The rules are simple. Just like on the real Nclex, you can't call a friend or seek assistance during the test. I hope you have your writing materials, especially if you have any pharmacology dosage calculation.
Okay.
Again, you don't want to take so much time, maybe 4 minutes to answer each question. And I'm hoping you're in Nigeria, because if you're in Nigeria, you can actually win some good money for yourself. So you're going to start at 0 naira. And for each question you answer correctly, you're going to accumulate money along the way. And at any point, you can choose to walk away with what you have earned so far. Your winnings is going to accumulate until you get to some safe havens, which is a guarantee that even if you fail, you can go home with that amount. So I'll let you know when you're at each safe haven. And at some point, even though you won't have it on the real Nclex, but I'm going to give you an option of a 50-50 lifeline, where I would eliminate 2 wrong answers and help you to get the right answer. Okay, so let's go with question 1 for 500 naira.
Okay. Okay, am I expected to read this out?
Yeah, you can read it out, you can internalize it, anyone is fine.
Okay. Most I would go with option A.
Okay, so like I said, it's going to be a learning session. Again, I always want you to remember when you're writing the Nclex, always remember that the Nclex is a safety exam. Always think about what you can do for your patient to keep him safe at that moment. So again, I'm going to ask you to choose another option.
You don't place pillow under the head. You just have to let the patient lie. Placing a padded tongue. I know we don't place things in the patient's mouth, but then again, you should have to prevent the patient from biting the tongue off. Okay. Straddle the legs and hold the arms. You don't hold. I'm thinking option C again.
Well, again, we do not put things in a patient's mouth on the Nclex. That's not safe. A patient can bite on it and break it and could cause aspiration and all of that.
Yeah.
So again, option C is always going to be wrong on the Nclex.
Yeah. Okay.
And don't be fixated on textbooks. Again, in all of the options you have, which is the best that can keep your patient safe?
Wish it was another question. Can I use, it's too early to use a lifeline here.
It's too early because we're even starting with the easy questions.
Yeah. Why am I battling with this? Okay. Good. Okay, I'll go with this under the head. Okay, to prevent aspiration. You don't hold the patient's arms and legs. No, I don't think it's option D. I thought this was gonna be easy.
It's actually very easy.
Can I call for help? Can I call for help?
So again, always remember on the Nclex, if you can do one thing and walk away, if there's only one thing you can do for this patient that would keep him safe, would it be to call for help? And that's it.
No. Call for help. I know it wouldn't be call for help. At least you should do something before you call for help. Seizure. You should be able to do something if the patient is having a seizure.
So again, I always talk about using the decision tree, and in step 5, we talk about evaluating your answer option. What would be the worst that would happen if you place a pill under his head?
Nothing would happen. Nothing. It would even prevent aspiration.
Again, if he's banging his head on the ground as he's having that seizures, the pillow is going to help prevent all of that.
Like a cushion.
Again, I'm going to ask you to choose your answer.
Okay, then I'm going with option B.
Is that your final answer?
Yes, that's my final answer.
Okay, let me unveil it and see if you're correct. Okay, so again, you can see all of the proddings I'm giving you. That's what you want to use on the Nclex. What would keep this patient safe? If I can do one thing and walk away, what will be the outcome if I choose this answer? Is it going to help with this patient? Is it going to keep him safe? That's how you want to arrive at the correct answer on the Nclex. So congratulations, you are right. Again, remember, the first thing on the Nclex is to protect the client. So what else can we do for this patient? We can raise the bedside rails. If the patient is standing, we can ease him to the floor. We can place a pillow under his head. We can loosen tight clothing or clear the space around the client if he's flinging his hands and legs around. So always remember, nothing should be inserted into the patient's mouth. Because and again, with option D, when you try to restrain the patient, it can cause dislocation, it can cause fracture in this patient. Okay, let's look at question 2 for 1,000 naira. Are you ready?
Yes, I'm ready.
Okay.
The nurse receives a phone call from an adolescent. Please, there is no reason to leave. I'm going to kill myself. Which response is best? Option A, do you have access to a gun? No. Option B, why do you want to shoot yourself? Option C, think about how this will affect your family. Option D, everything will be okay, have faith in God. No. Okay, I would go with option B.
Option B.
Yes.
Okay, so again, like I said, it's a learning session, and it's nice you are going with the wrong answers because it helped me to clarify some points. And on the Nclex, you do not ask why on the Nclex. Why questions are always wrong on the Nclex? Take it to the bank. Why questions are almost always wrong on the Nclex. You do not ask why questions.
Okay.
So is that your final answer?
No, not at all. Then I'm going to go with option C. Think about how this will affect your family.
Again, would this be the best response for someone who says, I don't have any reason to live? Again, who is your patient? Is it the patient or his family? Who is your priority concern? Who are you supposed to focus on?
It's the patient.
It's a patient. So focus on him and not his family.
Do I need to ask, do you have access to a gun? Okay.
So again, if he has access to a gun, what do you think? He's more than likely to kill himself. He's going to use it. He has access. If he has access to a gun, it's a higher priority for you.
Yes. So it's going to be option A because you don't give them false hope like everything would be okay.
Yes, we don't give all those false reassurances. Yes. We don't do that on the Nclex. Is option A your final answer?
Yes, option A is my final answer. Thank you.
Okay, let's see if you're right. Okay, congratulations, you're right. Let's look at question 3 for 2,000 naira.
Okay. it's here for the clients who have the chest tube connected. I've got chest tube. No. Okay, disposable chest tube system is the function of the system. The chest tube using tongue and a forefinger. Keep the water level in the water seal chamber at 2 seconds. Chest tube. I keep saying I'll read chest tube. I've not really gotten to.
Again, I remember seeing chest tube on my Nclex test day. So you really want to go back and read up on chest tube.
I keep saying I'll read it. But gosh, I think I have to read it this night. Okay, let me keep going. It's definitely not A. Milk the chest tube using thumb and forefinger. Keep water level in the water seal chamber at the 2 cm mark. C. Place the chest drainage system at the level of the chest. No, not C. Then clamp the chest tube when ambulating. Keep the water. I'm left between option B and D. And let me read them again. Keep water level in the water seal chamber at 2 cm mark. Man, I really need to have an idea of this. Clamp the chest tube when ambulating. Thinking it shouldn't be C because it's expected to drain. So I'm reading out C. A. Milk the chest tube using the thumb. I don't even know.
You say it's expected to drain, so it wants to be lower than the patient.
Yes, it has to be
level
lower
of the chest. Yes.
Okay. Yes, not at the level of the chest. So this A, I don't know what it is, but it's not looking like the answer. I'm thinking B or D. Now, keep the water level in the water seal chamber at 2 cm mark. I'm not sure. I think I will go with D.
Again, would D be your final answer?
Keep the water level. Can I ask the audience?
Well, you have the 50-50, so you can use it.
Keep the water level. Keep the water level in the chamber 2 cm mark. I don't know how many cm mark is expected. I don't know the level of the water. Just like I said, I keep saying I'll reach chest tube. Like I've come across it so many times. I'll go with D. Yeah, that's my final answer.
I still want to insist you have the 50-50 option.
If I use it now, I might be left with B and D, and it doesn't really make sense for me.
Again, do you want to clamp the chest tube? Do we need to clamp
ambulating?
The chest tube?
Why ambulating? They said,
so what's the worst that will happen when he's ambulating? Because we want to maintain that patency.
Okay. Man, make the chest tube.
It's called a chest tube drainage system. So you don't want to clamp the tube.
You don't want to
flow obstructed.
So it has to be continuous flow. The chest tube using tongue. I'll go with option B. Although it looks more like it, but just I don't know the level, like the number. It has to be the water.
Again, you can use elimination. I keep insisting there's no way you're going to read up on everything on the Nclex. By eliminating the wrong answer choices, you can be left with one you can't explain. But because
that was why I eliminated option C.
I know I don't want you milking the chest tube. That would be wrong practice.
Yes.
Because it could traumatize the
patient.
Yeah, the inner linings of the patient. So you don't want to do that. Again, by eliminating A, eliminating D, eliminating C, even though we are not sure whether it's a 2 cm mark, but because we are sure that A, C, and D is wrong, then we can go with option. So you want to use that technique on the Nclex. So is option B your final answer?
Yes, option B is my final answer.
Okay, let's see if you're right.
Yeah.
So all always remember when you keep the water level in the water seal chamber at the 2 cm mark, it's going to prevent air from flowing backwards into the client. So it's going to prevent air from flowing backwards into the client. And when you milk, you know what milking is? I don't know, but we
like,
do it.
Milking a cow, kind of. I don't
No,
know.
not well, okay, like milking a cow, but you know what we do when your IV line is clogged? It's no longer flowing. Then you use your thumb and your finger to pull back on the tube. So that's what it refers to as milking. And when you milk your chest tube, it's going to create extreme pressures in the chest tube, and that can damage the lung tissues.
Okay.
So we don't want to milk our chest tube. Again, we said the chest tube we want it to be maintained below the chest level so that you can use gravity to aid drainage. Again, if you are clamping the tube, it should never be clamped for an extended period because it also increases the risk for a tension pneumothorax.
Okay.
So we only clamp the tube when we are trying to determine the source of an air leak, or maybe when there's a tube disconnection. That's only when you want to clamp the tube. So that's like a synopsis on your chest tube drainage system. So one, we said we want the water seal chamber. We want the water in the water seal chamber at the 2 cm mark. And we said it's going to help to prevent air from flowing backwards into the client. Again, we said you don't want to milk your chest tube. We don't want to milk that. It's going to damage the lung tissues. Again, we want to maintain our chest drainage system below the chest. So you want it lower so that you can use gravity to aid drainage. And finally, we said we don't want to clamp the tube for long periods because it could increase the risk of having a tension pneumothorax in your client. So if we are going to clamp the tube, we are only going to do it when we are trying to determine the source of an air leak or maybe our tube disconnected. So either you take the disconnected part and put in a cup of water, or you want to clamp it temporarily. So that's the only period when we are clamping a chest tube. So again, this is your chest tube, even though we won't have time to go through this. But again, with the collection chamber, so that's our collection chamber down here. So what you need to do, you want to always assess the amount and the appearance every shift. So that's where your drainage is coming in from. So you always want to assess the amount of the drainage. You want to assess the appearance. Again, with the water seal chamber. So that's your water seal chamber there. So that's your water seal chamber there. That's where we want to assess for a leak. You're always going to be assessing for tidalling. So you can go back again and read up all of this, but these are key pointers you need to know. Assess for tidalling. And with the suction control chamber, always ensure it is filled with sterile water to the 20 cm mark. So that's another measurement you need to be aware of. So we talked about the 2 cm mark with our water seal chamber, but with our suction control chamber, we want to ensure the sterile water is up to the 20 cm mark. Okay, congratulations, you're up to 3,000.
Okay, thank you.
Now let's look at question number 4 for 3,000 naira.
Okay. A client with a dilated cardiomyopathy has reading shown in the exhibit. Which action should we take? First of all, please determine what this is, which I don't even know. I don't know what this reading. It's like, it's looking like I don't even know what it's looking like. Oh God, but I don't know. Okay, let me use my elimination method. The client with dilated cardiomyopathy has the reading shown in the exhibit. ECG is one of my problems with this my reading. So, which action should the nurse take first? A, assess the client for pulse. B, assess the oxygen saturation. C, initiate CPR. D, prepare to defibrillate. Okay, I would go with A. First of all, I need to assess this client to be sure that, okay, there's a pause before I would even start doing anything. Yeah.
Is that your final answer?
Yes, that is my final answer.
Okay.
Yeah.
So let's, if you're correct.
Yeah. But what should you call this? Is it asystole or atrial fibrillation? Asystole is flat.
So if I ask you, does this rhythm look fast or slow?
1, 2, 3, 4, 5, 6, 7. It's fast. It's definitely fast.
Again, you just need to focus on the RR intervals. Are they close together or are they far apart? Because I see that they are close together, that tells me the rhythm is fast. So what do you normally call a fast rhythm?
Tachycardia.
That's a tachycardic rhythm. Again, how do we know which type of tachycardia this is? Again, I still wonder why we've taken time to do all these classes, put up the videos, and then people are not going back to watch those videos. It's because for you to come on the next class and say you've not seen this rhythm, you don't know what this rhythm is, it means you've not gone through the
I've read it. See, it's not like I've not read it. I've read it, but I couldn't remember.
I mean, watching the videos, because I break it down. I'm only going to ask you two things when you identify a rhythm. Is it fast or slow? Is the QRS complex wide or narrow? Because like I mentioned on those videos, I said if the QRS complex is narrow, then it means the impulse is coming from where it should come from. It's coming from above. It's coming from the atrias. It's of supraventricular origin. But if the QRS complexes are wide, then it means it's coming from the ventricles. And because these QRS complexes are wide, I'm going to call this a ventricular tachycardia. So again, go back and watch those videos. That's all you need to know. Don't go reading agonal rhythms, Wolff-Parkinson's White syndromes, and all of that. Just focus on what we've covered on the Nclex, on the videos. Okay, so well done.
Thank you.
Okay, so again, you need to get this answer right, and you are sure of going home with 5,000 naira. If you fail this, you lose everything. So once you cross this, you are sure of going home with 5,000 naira. So here's question 5 for 5,000 naira.
Okay. Let's look at the instructive pressure circle. You see an internal figure where that possibility which tax does not replace UAP. A, provide a mouth care, accessing the oral cavity, talk with the client about coping strategies, assist with the client's personal hygiene, verify the amount of placebo prior to the feeding. Instructive precipitation circle. I'm going with option C.
You need to take your time. Read the
Hold
options.
Hold on, please. Let me verify the amount of risk.
This is the easiest question.
Assist with personal hygiene. I'm going with option C.
Again, you have 50-50. You can use it now, or we can lock in your answer for option C.
Assist with personal hygiene. You make it look like I don't really know their work again. Verify they do measurements. I'm going with option C.
Again, is that your final answer? This is the easiest question. Is that your final answer?
Yes.
Come again. Is that your final answer?
Yes, that's my final answer.
Okay, so let's see if you're correct. Okay, so congratulations, you're right. Again,
Yeah.
I'm not sure why you are spending so much time on this. I use...
when you see some things, you'll be like, okay, is it this or is it that? I don't really know again.
Again, you want to use those techniques. Again, we do not delegate what we can eat. You do not delegate what you can eat. Look at those keywords there. You must be my daughter watches this movie, Dora the Investigator,
Explorer.
whatever you call it. Yeah. So she investigates and does all of that. You want to be a word detective. Pick out, because if I see assessing there, I know I don't delegate assessment.
Yeah, I know.
If I see talk with the patient, I know I don't delegate education, client education. The verify is also a way of assessing. I do not delegate that. Client teaching, you don't delegate that. So this is not a real question. This is like a walkover. Okay, so congratulations. You won yourself 5,000 naira this night. So you can send your account details in the WhatsApp group and you'll be credited for that. Would you like to go home with this 5,000 or you want to keep going?
Let me just keep going and let's see.
Okay. Let's look at question 6 for 7,000 naira.
This calculation. Okay, you just have to give me some time. The client receiving IV heparin 1,200 units per hour. Prescribed over available. Okay. Has the dose changed to 1,100 units per hour. The concentration of heparin is in 25,000 units per meal per 250 meals in normal saline. When adjusting the infusion pump to deliver the 1,100 units, okay, the nurse sets the infusion pump at how many mil per hour? Okay, 100 times 250 over 25,000. I'm gonna do some calculations. 1, 2, 3, 1, 2, 3. 25, 25. Okay, I'm left with option B.
Is that your final
B is
answer?
my answer. Yes, please. B.
Okay, so let's see if you're right. Okay, congratulations. You got the answer right.
Thank you.
For me, I use dimensional analysis, which we'll be teaching on the course in the nearest future.
Okay.
I'm just going to let this be. So what I will do is I'll put my meals over hour. And again, I'm going to put my dash times. So it's a constant formula that I use. Whatever you do, you're never failing the question. So again, this is going to be my starting and this is going to be my ending. So I'm going to pick my starting and move it over here. And I go back to the question, do I have meals anywhere? Yes, I have meals. I have 250 meals. And again, I see them as husbands and wife, 250 meals per 25,000 units. So my 250 is going to go up here and my 25,000 units is going to come up here. And again, the lower unit is going to climb the mountain. So I'm going to take my units and move it up here. Then I go back to the question and I ask myself, do I have units anywhere? Yes, I have units here. I have 1,100 units. I'm going to put that here, 1,100 units. And then that's a wife there, hours. So I'm going to move hours under here. So like I mentioned, I started with meals. I'm also going to end with hours. And if I do the maths, I'm also going to end up with 11 meals per hour because the unit here is going to cancel the units here and I'm left with meal over hour. So that's how I will do mine, but again, I'll break it down on a subsequent class. Okay, so well done.
I did prescribed over available.
Yeah, the good thing with dimension analysis is that I can apply it to every question on the Nclex. if you use dimensional analysis, I can swear to you that if you fail any pharmacology question on the Nclex, I will pay you ₦1,000,000 because I know it works for every question. All you need to do is to, but again, I'll take the class subsequently and show everybody how you can use this on the Nclex. Okay.
Okay.
So let's look at question 7 for 10,000 naira.
Okay.
Again, remember, you could walk away with the 7,000 naira because if you fail any question, you're going back to 5,000 naira.
Okay. Okay. You must receive a prescription to instill out of place 2 milligram into the client's VAD, fish finding dose. Does the nurse report a possible contraindication for this therapy? Okay, so what do we even use it for again? I can't even remember it. It's not so sluggish blood return from the device is noted. Fish finding does not report as a possible contraindication. This therapy. It has to be said, pregnancy and discharge at the CVAD reception site. Diagnosis of acute ischemic stroke 3 months ago. Client is receiving long-term antibiotic therapy.
You want to start with what is alter place?
I can't hear you, please.
What is alter place? That's where you want to start from.
Yeah, I know it's a drug you use it like an anti-thrombotic agent or something.
So an anticoagulant. Okay, go ahead.
Yeah, we use it to prevent thrombosis. Yeah. Okay, we are looking for the contraindication. Do not receive a prescription to instill milligram into the client. I'm not really sure.
Come again?
I'm thinking of redness and discharge noted at the I'm not sure. I don't know.
Client is receiving long-term antibiotic therapy, diagnosis of acute ischemic. Well, just go through the options.
Okay.
And let me know your final answer.
Okay. Sluggish blood return. The device is muted. Can I use my 50-50 at this time? Oh, wait.
Yeah, go ahead.
Sluggish blood return from the device is noted. The fish finding does not report as a possible contraindication. Okay, what I would say, and I cannot use this. If there is bleeding, I don't think I should use this. There is some acute ischemic stroke 3 months ago. Use it for use it
You know,
for.
each time, for each option, there's something they are trying to tell you. Almost like each
Okay.
option is a topic on its own. You need to
Okay.
decipher what they are trying to tell you when they talk about sluggish return, when they talk about his heart stroke 3 months ago, when they talk about long antibiotic therapies. There are possible drug-drug interaction.
Okay. Mm. I know it's used in patient that has what's it called? It's EMI to dislodge clots. We use it for stroke, in ischemic stroke. So I don't think it's safe. Client receiving a long-term antibiotic therapy, sluggish return from the device. Sluggish return. We use it for this redness and discharge. I'm thinking B. Thinking of B. Thinking of B. B. B or D. Can I use 50-50? Just eliminate, let me use my 50-50. See. Can you hear me? Hello? I can't hear you again. No? I can't hear. I can't hear. I don't know if any other person can hear, but I really can't hear. Okay, maybe it's from their own end. Yeah, it could be their network. Yeah. Yeah, I think so too. I don't know. Maybe while we wait, I don't know if anybody I don't know if anybody can help with that chest tube stuff. So if anybody is anybody so good at it, maybe just say one or two things you think you know about it. The chest tube. If we can, maybe we can just pick something before we go this night. Oh, Esther, thank you. It's tough, honestly. Okay, I said while we are waiting for them to reconnect, I don't know if they would. Can anybody say something they know about the chest tube? Because we are all here to learn too. So if you think you know something you can say about maybe that chest tube drainage, because for me, I know how many times I've said, okay, I'm gonna go back and read it. I'm gonna go back and read it. You know, there is a lot to cover. There is a lot to read, but man, you never can tell. Wilton, did you hear what I said? Okay, then.